Security Program. For details, you can visit our webpage.
Hello everyone, and welcome to this session today on Living Well, Prioritizing Mental Health. Today is 10th of October, and on this day today we celebrate the World Mental Health Day all over the world. Let us see the background of this World Mental Health Day. Initially, when the WHO, World Health Organization, was started in the year 1948, its Director General George Brock-Sissom had taken the initiative to start the World Federation for Mental Health. Okay. And under this World Federation for Mental Health, it started celebrating the World Mental Health Day on the 10th of October from 1992. Since that time, every year the World Mental Health Day is celebrated on 10th of October. And for this World Mental Health Day, every year the WHO keeps a theme for this day. And this time for the 2024 World Mental Health Day, the theme is it is time to prioritize mental health and well-being in the workplace. So similarly, in the previous years also, we have seen that under 2023, the theme was mental health as a universal human right. In 2022, it was mental health and well-being as a global priority. 2021, it was mental health for all. 2020, it was, if you remember, it was the COVID year. So that time the theme for this World Mental Health Day was investing in mental health. 2019, it was focused on suicide prevention. And 2018, it was mental health in young people. So if you see the various themes, the WHO usually keeps themes related to the various aspects of mental health, sometimes focusing on the younger generation, sometimes focusing on the suicide prevention, or as a theme for investing in mental health of people. So there are various themes related to this particular World Mental Health Day. Okay. Now, what are the objectives of this Mental Health Day? Okay. First of all, it was to promote awareness about mental health among all. Okay. So creating mental health awareness is one of the objectives of this day, and as well as promoting mental health and prevention of mental disorders also. Okay. And also it aims at providing adequate services for mental health conditions and rehabilitating people with mental health conditions. Okay. Along with this, there is also focus on advocacy, research and policy formulation, because policy formulation is very important. Unless we have a policy related to the promotion of mental health, then that will facilitate in spreading awareness about this particular concept. Okay, what is mental health and how do we promote mental health? How do we take care of our mental health at different places, at in the personal life as well as professional life also. So mainly the objectives of the World Mental Health Day, it broadly focuses on creating awareness, promotion of mental health, provision of services to people having different mental health related issues and conditions, and also at the same time at the policy level or conducting research in this area and policy formulation also. Okay. Now, so keeping all these things in mind, in today's presentation, we will be focusing on what exactly is mental health, okay, the meaning of mental health. Then we will also focus on discuss on various myths and misconceptions around the topic mental health. We will also discuss about the factors affecting mental health and how do we identify cases where we can say there are certain mental health conditions or issues faced by the people. So the signs of mental health related issues, that also we will be discussing today. And finally, the different measures that can be taken to promote mental health and well-being. Okay, so all these things we will be covering in the today's session. Now, before we start on discussing what is the meaning of mental health or what do we understand when we say mental health and well-being, let us see some data that is they are related to the mental health issues. Now, WHO, it indicates that the 1 in every 8 people in the world, they live with a mental disorder. Okay. Now, mental disorders are severe conditions related to mental health. Similarly, 1 in every 5 persons in India, they face some kind of symptoms related to mental health issues or problems. Okay, so here when we are saying mental health related issues or problems, it is not disorders, but 1 in every 5 people, they are faced with certain kinds of mental health related issues that might not be leading to disorders, but it is some kind of some mental health related issues they are faced with. Okay, also we see that 50% of mental health conditions, it starts by the age of 14. So this also indicates that we need to be focusing on our younger generation also and give priority to their mental health conditions also, because when we are saying 50% of the mental health conditions, it starts by age 14, it is really important to focus on the mental health and well-being of our younger generation, especially in this digital era where so much of technology is there. We need to be focusing more on the mental health of the younger people. Also, the data indicates that the common mental disorders like anxiety and depression, okay, these kind of disorders account for 40% of mental disorders. Okay. So all this data indicate that it is a matter of great concern that mental health disorders or mental health related conditions are on the rise. So we need to be focusing more and more on the mental health related issues and aspects, starting from the individual level as well as at the society level and at the policy level also. So that is one of the objectives of this celebrating the World Mental Health Day is the policy formulation, conducting research and creating awareness about these issues. Now let us now see certain kinds of myths and misconceptions that are related to mental health. When we talk about mental health, usually the meaning is not very clear among the general public. Okay. So there are different kinds of misconceptions that are related to this concept. For instance, it is said that people having a mental health condition, they are low in intelligence, intellectual ability, or they mostly come from low social class and economic condition. Okay. But this is a misconception, because we see that mental health conditions or mental health related issues or mental disorders can affect anyone. Okay, so the person, irrespective of the social class, social background, the socioeconomic status, or irrespective of the age, or irrespective of the kind of background or the socioeconomic cultural background that the person is coming from, or irrespective of the intellectual ability of the person. So mental health conditions or mental health related issues, it can affect anyone of any age group, of any coming from any social economic condition also. Okay. Similarly, another misconception that is prevalent is that if one doesn't have a mental health condition, one need not bother about one's mental health. This is also a misconception that only when we have a mental health related condition or any kind of mental disorders, then only we need to think about mental health. This is a misconception, because as we talk about physical health, similarly one needs to be talking about mental health and equally focusing on having a good mental health or promoting one's mental health. So that is how we need to be focusing more on the mental health of each one of us. Similarly, there are also other kinds of misconceptions that are prevalent. Mental health conditions do not usually affect young children and adolescents. Okay, as I just spoke about the data that 50% of the mental health related issues, it starts by the age of 14. So this itself indicates that children or adolescents or young children, they are also they can be affected by mental health related issues and conditions. So this is also a misconception that children are not affected by mental health related conditions. Similarly, when we say that mental health related issues affect only, or it occurs only to those who are having weak personality or who lack willpower, this is also a wrong notion, because it doesn't have to do anything with this kind of having any kind of personality, okay, or having lack of or less willpower. Okay. It is not that if a person has willpower, the person is able to overcome that particular condition. So because mental health is affected by a variety of factors that we will be discussing later on. So that is how it is not true that if a person is having weak personality or low in self-confidence or willpower, that person will not will be affected by mental health conditions. Okay. So these are the various myths about mental health. Also, it says that children and adolescents who are good in studies, or people who have achieved success in their life, okay, they will not have any kind of mental health conditions. Okay, this is also not true, because mental health conditions can occur to anyone. Okay, whether one is studying good or doing well in a life, that doesn't matter. It can affect anyone in life also. Further, it is also said that we cannot do anything with regard to having or preventing mental health issues. Okay, it is not true, because there are provisions that can be done. There are steps that we can take to prevent mental health conditions. Okay, so one aspect is prevention. The other aspect is the promotion aspect. So definitely various steps can be taken to prevent mental health conditions, and also we can adopt various strategies to promote our mental health. Now, so similarly also we see that there is no recovery. This is also not true, because recovery is possible, treatment is possible, and people can be rehabilitated, and they can recover from mental health conditions also. Okay, and these mental health conditions also can be managed well. Okay. Now, after this, let us see, when we are discussing about the various myths and misconceptions related to mental health. Now let us focus on what exactly is mental health. The WHO, it has said that mental health is a state of well-being where the individual realizes his or her abilities, can cope with the normal stresses of life, can work productively, and is able to contribute effectively to the community. So if you see this definition given by the WHO, it focuses on the individual, like the individual is able to realize whatever potential the person is having, and at the same time the person is able to, whatever the stresses that occur in the normal day-to-day life, okay, those stresses the person is able to cope with, and is able to contribute to the particular like field or the organization, and there is this thing that the person is able to contribute significantly to the community. Okay, so there is a contribution to the community also involved here when we are discussing about mental health. Okay. Now, usually we talk about mental health in terms of a continuum. Okay, in the continuum, if you see, we start with, suppose there is a presence of mental disorder, where we can say that the person is having mental disorder. Then if we progress in the continuum, there is the absence of mental disorder. The disorder, the person is not having any kind of disorder. Now, when the person is not having any kind of mental disorder, can we say that the person is mentally healthy? No, because we need to move beyond that point also. From the absence of disorder, we need to move beyond, where we can talk about positive mental health, where we can talk about the optimum level of living. So when we reach that optimum level of living, then only we can say that it is like the person is having good mental health. Like for example, if we talk about physical health, the person may not be having any kind of physical disease, but still the various parameters of the health might not be functioning up to the optimum level. So that means from the absence of any disease or disorder, we need to move beyond that point, so that we can say that there is positive mental health, or there is optimum living. Okay. Now here let me make it clear about what do we mean by mental disorders. Mental disorders are severe mental health conditions where there is like behavior is affected, thinking is affected, and emotional regulation is affected. So there are significant disturbances in these three aspects of a person's life. Thinking is affected, emotional regulation is affected, and behavior is affected. When these things are affected significantly, there is significant disturbance related to these three aspects of the individual's life, and it affects his day-to-day functioning in a significant manner, then only we say that accounts to mental disorders. Okay. So when we talk about mental health, we usually talk about the biopsychosocial spiritual model of mental health. This means that it indicates the involvement of physical aspects, the biological aspects playing a role in our mental health, psychological aspect, socio-cultural aspect, and spiritual aspect also. Okay. So all these aspects affect one's mental health. So related to this, we talk about the biological factors that affect our mental health, like for example, the genetic factors or the hereditary factors play a role in one's mental disorders or mental health conditions. Similarly, one's physical health, because there is always a connection between body and mind, physical health and mental health. So physical health, one's diet, sleep, exercise, even the use of substances, that also can affect our mental health condition. Okay. Similarly, our psychological aspects also, which relates to our thoughts, our beliefs, and our emotions. Okay. These factors also can affect our mental health conditions. Okay. Our belief systems are emotion related, like the feeling of lack of control, or the kind of stress or trauma the person is undergoing through. So these things also can affect our mental health condition. Similarly, social related factors also, that is one's relationship with family, peer group, or the community. All these things, or the environmental factors, the socio-cultural factors also affects one's mental health. Okay. Now, when we are seeing the mental health related conditions, various factors affect these mental health conditions. So here we can see that what are the signs, or how to identify these mental health conditions. So here also we can say there are physical symptoms, like there can be sleep disturbances, lack of energy, fatigue. All these physical symptoms can be there, or it can be cognitive symptoms or emotional symptoms. Like for example, there might be negative thoughts, there might be worry, lots of like constant worrying about different things, constant anxiety about different things, or there can be guilt or resentment or lack of concentration. Okay. Similarly, the person might be feeling nervousness or fear or excessive sadness. All these things can be there. These are the different signs of mental health related conditions. Similarly, we can also see the behavioral symptoms. There can be excessive sleep, or lack of energy, or there can be self-destructive behavior or restlessness, or there is sudden changes in the eating patterns. Okay. Or there can be major changes in the one's behavior and personality also. The person might be facing difficulty in coping with daily life things also. The earlier, like a normal person might be able to, like if you recall the WHO definition, it included that the person is able to cope with the normal stresses of life. So if a person is having mental health conditions, the person might be facing difficulty in coping with these day-to-day stresses also. Okay, so all these things related to physical, psychological and behavioral aspects we need to be attentive to, so that we can identify that okay, the person might be facing certain kind of health mental health related issues or conditions. Okay, now when we are talking about this different signs, this is very important that we need to focus on these three parameters or these three aspects when we are discussing about the signs to identify the mental health related issues. One is the duration, second is frequency, and third is impact on daily functioning. So that means what is the duration of these symptoms? Like for example, the person is feeling irritable. So what is the duration? Or the person is feeling sadness, okay, or excessive anger, okay, or aggression. So what is the duration of these signs? Okay, because the duration also matters, because sometimes suppose you had an argument with your friend, okay, and then you feel that okay, and that you feel very irritable after that, or you are very upset about your friend, but that lasts for some time only. So if it continues for a longer period of time, then one needs to be concerned about this. Okay. Similarly, the frequency. How frequently does this happen? Okay. If it is once or twice, or if it is more often, does this happen? Okay. And similarly, the impact on daily functioning. So this particular incident, how does it impact your daily functioning? Okay. So whenever we are focusing on these different signs related to the physical, emotional, cognitive or behavioral signs, we need to be aware about these three, we need to take into account these three parameters: the impact on daily functioning, the duration and the frequency. Then only we can say that whether the person is having some mental health related issues or not, okay, or it is just a normal behavioral indication. Okay, so that is when we are talking about the signs and symptoms related to mental health conditions, we need to be keeping a focus on duration of this, the frequency of this, and also the impact on daily functioning. Now, after we discussed about what is mental health, the meaning of mental health, the misconceptions related to mental health, the signs, how to identify the mental health related issues and conditions, or the factors that impact or affect our mental health. Now, let us focus on the what are the steps or strategies that can be adopted to promote or enhance our mental health and well-being. So these can be from three different aspects, like individual level. Steps can be taken at the individual level. We can take steps at the collective level and also at the policy level. So this is very important, because when we are talking about promotion of mental health, it cannot be from one side only, or steps cannot be taken from one side. So that is why a multi-sectoral approach, a comprehensive approach is required to address the mental health related issues and take different strategies or promote different strategies, so that the mental health and well-being of the individual can be enhanced. Okay. So now let us see at the individual level what are the things that can be done to promote mental health. In any situation, as an individual, the person is engaged in these three sequences. Okay, the first, there is an activating event. Okay, like as I was giving the example, suppose you had an argument with your friend. Okay, so that is the activating event. And then the consequence, the outcome of that was you felt upset about the particular situation, or you felt very upset or angry about your friend. So the instance was, the activating event was that argument with your friend, and the outcome or the consequence was that you felt angry about or upset about your friend. Now, what mediated that particular outcome or response? Okay, so that beliefs what are your beliefs, what are your thoughts, or what are your values. So these beliefs, thoughts and values that mediated your response or consequence. So similarly, in any kind of situation, we need to be aware of this sequence. What is the activating event, the stimulus or the situation, the input, and then what response or consequences happen and what mediated that particular response. Okay, so we need to be focusing on what kind of thoughts, values or beliefs that we had. Here in this particular example, you felt that your friend should not be behaving in that way, which led to your angry about your friend. So this kind of beliefs also affect our mental health. Okay. So at the individual level, we need to focus on self-care. That is one thing which can lead to good mental health. We need to be engaging more in gratitude, mindfulness, and then speaking out. We need to communicate our feelings to others around us. And reaching out is also one more important thing, where there are services, professional support is available, and we have to reach out to others, okay, in our family, in our friend group, friends group, in our peer group, and to the various professionals that are available. We need to reach out to them. So these are the different things we can do at the individual level to ensure or to help promote our mental health. Now, the Lancet Commission on Global Mental Health on Sustainable Development 2018, they have mentioned about 4 foundational pillars for the promotion of mental health. One is that they have considered mental health as a global public good. And then they also talk about mental health existing on a continuum. And the mental health of the individual, it is affected by one's social, environmental influences as well as the genetic, biological factors. Okay, and it is a fundamental human right, and it requires a rights-based approach. So in India also, the Mental Health Care Act that was that is available now, it is a rights-based approach. It has taken a rights-based approach to the concept of mental health. Okay. It ensures that the rights of people who are affected by mental health conditions or disorders, it is taken care of. Okay. So that is how it is a multi-sectoral approach can be undertaken, where we talk about self-care, we talk about the informal support that is required. We also talk about digital interventions, community-based mental health services, a life course approach focusing on mental health of people at each and every stage of life, and then integrating these mental health services with the primary healthcare services. And of course, the India is having a Mental Health Care Act 2017. Okay. Now, along with this, if we focus on the Indian traditional knowledge system also, in our own culture also we have this system, this knowledge tradition that we talk about, the Panchakosha theory, okay, where we are talking about Annamaya Kosha, Pranamaya Kosha, then we talk about Manomaya Kosha, Vijnanamaya Kosha and Anandamaya Kosha. Now, if we focus on these 5 koshas or aspects, okay, these focus on various aspects of our health, including our mental health. Okay. So, if we focus on these, the Panchakosha or the 5 layers of our life or the 5 aspects of our life, definitely our health will be taken care of. It will ensure that we live well, and our mental well-being will be ensured also. Like Annamaya Kosha, it talks about focusing on the bodily aspects of the physical health. It talks about Pranamaya Kosha, it also talks about taking care of focusing on the breathing aspect. It ensures that vital energy or the life force energy is ensured. Manomaya Kosha, it focuses on mind and mental functions like thoughts and emotions, which play a very important role in our mental health. Vijnanamaya Kosha also, it focuses on developing a higher intellect or the viveka that we call about, and the insight. Okay. And finally, Anandamaya Kosha, it talks about a state of transcendence, living a blissful state and ensuring true happiness. Okay. In Maslow's needs hierarchy theory also, in psychology, we talk about, the Maslow also talks about this highest state as transcendent state, where it says that going beyond the physical state, physical health, then mental health, cognitive health, emotional health, it talks about a higher state, that is transcendent state, where it is you go beyond the physical, mental and emotional health, and then you connect to a higher being. Okay, so that is a blissful state. That is why it is called as the Anandamaya state, and which ensures true happiness in one's life. So finally, related to this particular Panchakosha theory, we can always say that these are the 5 mantras that can be considered for ensuring our mental health and well-being. So these are: eat well, sleep well, exercise well, think well, and connect well. So by eating well, sleeping well, and exercise well, we can ensure our good physical health. Now, thinking well, think well, that ensures our mental health, our emotional wealth, and psychological health. And connecting well, it ensures our social well-being, and also taking us to connecting to a higher power also. Okay, so when we focus on these 5 aspects, it is said that, I mean, it can be ensured that we can take a holistic approach to our wellness. Okay, so that is how we need to focus on a holistic approach. We need to take a holistic approach to our mental health and well-being. Okay, and then only we can say that living well is possible by focusing on mental health and well-being. Okay, so with this we can thank you all.